AI, and digitalization are driving the world toward major changes in various industries. Healthcare, nevertheless, represents a fertile ground for impactful technologies that could dramatically improve our existence on Earth and beyond. Even though innovation seems to be unstoppable, there is a clear need to prepare the soil for these innovations to take roots and thrive. WHO expects the health sector to create 40 million jobs by 2030, and there is a foreseen gap of 2.6 million in physicians and 9 million in midwives and nurses. Although the majority of this tremendous number is not going to be part of the development of new technologies, we can be sure they will be the users. We all appreciate the effort profound by the financial community that seems to get very interested in the health tech sector. Indeed, over $7.4 billion have been invested in 2019 according to Deloitte. That dynamic will probably enable the leap we wonder on the technical side. But as long as the market is populated by patients and practitioners who are the real interface between medical devices and human under treatment, well, better to be careful with the implementation science. Now, it is clear that research institutions, private and public companies and universities has a significant role in preparing those professionals who craft the hardware and the software behind the equipment and the system. But I consider equally important to activate also the receivers. There is an interesting crossroads between data science and medical science, and unfortunately this seems not to be enough populated. As we experienced during the pandemic, training healthcare staff is not a matter of weeks, neither of months, but it requires a much longer period of time. Pumping fresh new resources to tackle new challenges will require a choral effort between, let's say, slowly heavy giants such as universities, national health systems, and many others. Another meaningful dossier to keep in mind is to upskill the current fleet, an interesting dossier that should be well thought ahead. Of course, there are some leading institutions that are currently developing and delivering knowledge in this area that will ease the development and deployment of what is in the labs right now. In these last couple of lines, I would like to mention them to push the conversation and sensibilize these impellent needs of our time. I picked two universities that represent one, the old continent, and the other one, the American friends. University of Amsterdam is the first one, with a Master in Medical Informatics that lasts for 2 years and that is open not only to medical background. And then there is a Stanford University with a graduate program in biomedical informatics. Either you are a student, a doctor, or a manager, I suggest you to take a look at their website, not only if you are interested in enrolling them, but to get a good understanding of which areas matters to them. I'm enthralled at the idea to unlock the power of AI to deliver a better health. And I'm completely aware of the importance of entrepreneurship in this path. Without any secondary purpose, I would like to point out Smash Medicine as an interesting project that involves AI to train new medical doctors. I recommend you to take a look and draw inspiration, since we urge a better understanding of this new concept.